One pregnancy on a short-term health plan can legally cost you tens of thousands of dollars because not a single short-term plan in the Kaiser Family Foundation's review covered maternity care. 0%. That cheap premium you were sold as a temporary stopgap can skip the exact care that turns a small gap into a financial disaster. And maternity is only the first thing they leave out. Millions of Americans without employer coverage reach for these plans because the monthly price looks unbeatable. I read the fine print, so you don't have to. Today, I'll show you the 4 categories they can legally drop and 3 moves to spot the gaps before you sign anything. Here's the number that should stop you cold. 71% of short-term plans in the KFF review did not cover outpatient prescription drugs, the single biggest routine gap in the sample. But here's the part nobody tells you. That's just one of 4 whole categories these plans can skip entirely. 3 moves. First, check the real coverage on healthcare.gov. Second, review the summary of benefits and coverage. Third, estimate your worst-case out-of-pocket. Each is free and takes under 20 minutes. The reason these plans can drop so much is simple. Short-term limited duration plans are not required to cover the 10 ACA essential health benefits. That means an insurer can legally omit whole categories: maternity, mental health, preventive care, and prescription drugs that any ACA-compliant plan must include. In the KFF review, 43% of plans did not cover mental health services, 62% did not cover substance use treatment, 71% did not cover outpatient prescriptions, and 0% covered maternity care. Compare that to ACA-compliant plans, which must cover all 10 essential benefits. The contrast is stark. The second layer of cost is medical underwriting. Short-term insurers can review your health history, deny you outright, or exclude conditions you already had, something ACA plans are barred from doing. On top of that, they can impose hard benefit caps. KFF found many policies capped covered benefits at $2 million or less, and some prescription drug benefits were capped as low as $3,000. So if you develop or already have a chronic condition, you can keep paying premiums while the plan quietly stops paying the claims that matter most. The myth is that short-term plans are basically cheaper versions of ACA insurance. The fact, according to KFF, is that they follow entirely different rules. No requirement to cover essential health benefits, freedom to exclude pre-existing conditions, and dollar caps ACA plans can't use. Put the 2 costs side by side. 0% of KFF sampled plans covered maternity care, and drug benefits were capped as low as $3,000. Combine excluded services with tiny caps, and one bad year can run into tens of thousands out of pocket. Meet Megan. She's 39, a freelance graphic designer earning $58,000 with no employer coverage and about $5,500 in savings. She bought a short-term plan for the low premium, 16 years out from retirement. Here's what she found buried in the fine print. Her first discovery: maternity care would be 100% self-pay. Because no short-term products in the KFF sample covered maternity, one pregnancy could leave Megan holding the entire bill. Tens of thousands of dollars her cheap plan simply wouldn't touch. Her second discovery hit the everyday stuff: prescriptions. 71% of sampled short-term plans didn't cover outpatient drugs, according to KFF, while ACA plans are required to cover essential benefits. For anyone on regular medication, that gap shows up the very first month. Before I get to her third discovery, which is the most counterintuitive part of all this, understand that even when a short-term plan says it covers something, that word can mean almost nothing. KFF found prescription drug caps as low as $3,000, far below the cost of many serious treatment courses. So Megan could be covered and still pay the vast majority herself. Stack it all together, and Megan's worst-case year could mean around $30,000 in uncovered costs, one maternity or specialty drug event, plus one capped follow-up condition. That's a modeled estimate from the KFF gaps. The real number depends on what happens, but the exposure is very real. So could this be you? You've never read your plan's exclusions or benefit caps. You don't know if maternity or prescriptions are actually covered, and you haven't compared it to an ACA plan on healthcare.gov. If any of those ring true, the next 3 moves are for you. These 3 moves take an afternoon, cost nothing, and can save you from a 5-figure surprise. You'll compare the real coverage, hunt down the hidden caps, and price your own worst-case year before you commit a single dollar to a plan. Move 1, check the marketplace on healthcare.gov. Go to the plan comparison section and look specifically for maternity, mental health, prescription drugs, and preventive care. Confirm whether each plan is ACA compliant or short-term limited duration. Then compare deductible, copay, and out-of-pocket max side by side. Here's how. Open the plan comparison for your state and income. Then list which essential benefits each plan actually covers. Compare deductible, copay, and out-of-pocket max. Good looks like a plan that covers all essential benefits and has a real out-of-pocket cap. Move 2. Review the summary of benefits and coverage. Pull it from the insurer's enrollment page or PDF and find the sections on pre-existing conditions, exclusions, and annual or lifetime caps. Note any dollar limits, like a $3,000 drug cap or a $2 million lifetime maximum. Here's how. Download the summary of benefits and coverage, find the pre-existing, exclusions, and cap sections, and note every dollar cap and excluded service. Good looks like no hidden caps on the care you're actually going to use. Move 3, the most important, estimate your worst-case exposure. List 3 services you're likely to need this year. Mark each as covered, limited, or excluded, then add up the uncovered share. Compare that against the premium savings, using the ACA Marketplace quote as your benchmark. Here's how. List 3 likely services for the coming year, mark each covered, limited, or excluded, then add the uncovered costs, and compare them to your premium savings. Good looks like savings that don't quietly come from dropped coverage. If breakdowns like this are useful, subscribe. The next one's already coming. Why now? In 2018, federal rules expanded short-term durations, growing their role in the market. In 2024, federal policy tightened and cut the maximum duration of most short-term plans. And in 2025, open enrollment shopping keeps exposing the mismatch between short-term exclusions and essential benefits. Duration rules have changed recently, so re-verify the current limits for your plan, year before you enroll. After you act, here's how to know you're safe. You should see every essential benefit listed as covered, not just mentioned. Confirm there's a true out-of-pocket maximum, not just caps. And if any service is excluded, price it out before you enroll, not after. Everything I cited today comes from KFF, healthinsurance.org, healthcare.gov, and the Center on Budget and Policy Priorities. I've dropped the full links below so you can verify every number for yourself. You just learned the 4 categories short-term plans quietly skip and 3 moves to catch them. Next, I'm covering how ACA subsidy clawbacks blindside freelancers at tax time, the bill that arrives a year later. That clawback catches thousands of self-employed people off guard every single spring, and there's a simple way to avoid it. If you want to catch that one, subscribe now so you don't miss it.